My name's Liz. This is my story. So when my daughter, my youngest child, started to have what I thought were quite serious mental health problems at the age of 13, I sought help first from school. Unfortunately, school labelled her problems as behaviour issues. Initially, we had a good experience with CAMS once she was diagnosed with anxiety and depression, but by that stage it was like CAMS were already one step behind what was happening in her real life. She couldn't go to school at all anymore. So then we felt, well, what's going to happen to her education? CAMS couldn't offer anything meaningful. They offered 5 hours a week of tutoring in a public place. Our daughter now had agoraphobia and couldn't go out unaccompanied. She's now 17. She's been unable to engage in any formal education for the last 3 years now, but her mental health problems mean that she can't go out of the house on her own. She hasn't got friends, and the impact on on our family has become a real strain. I take her to her CAMS appointments where she sees a psychiatrist who prescribes medication for her. But I don't see her psychiatrist, even though she's still under 18. I've had to demand involvement in my daughter's treatment by CAMS. We've given up on the education system because they gave up on her. To me, as a parent, it beggars belief that in this era where there's so much understanding of the need to address young people's mental health problems early on, that a young person who presents at 13 with very clear, albeit complex, symptoms can end up at 17 with no prospect of taking part in a meaningful adult life. And as a family, we're coping with that in better or worse ways. I suppose when I think about this whole experience over the last 5 years, that what I want to say to as many people who will listen is, I've read all those policy documents that claim that joined up services are the way forward, and yes they are, so let's join up teacher training and CAMS workers in schools and social services with the support they can offer in the community, in our homes. We need it. I need it. My daughter needs it.
Hi, my name's Sai and I'm happy to still be here to share my story with you. I was diagnosed with anorexia and depression at the age of 10, and I was a 10-year-old. I didn't even know what was happening to me. I had no idea what I was going through. Neither did my family, to be honest. I'm from an Asian background and things like this are very hidden about, not very much talked about. And to be honest, I didn't even know these things existed. I didn't even know what mental health was. At the age of 11, my weight had got quite low that I had to be in hospital in very, very intensive care, and then I got admitted into a psychiatric unit at the age of 12. I initially thought I'd be there for 2 weeks, and then it turned out I was there for 2 years, and then from there I got transferred onto another a specialist eating disorder unit called Rhodes Farm, and I was also there for about a year and a half, almost 2 years. So I've spent the last 4 years of my life in hospitals. People have a lot of misunderstandings about anorexia, and people don't really understand what it is. Most people don't even think it's an illness. They don't look past the bikini bodies and wanting to look like a model. I starved myself because I needed a way out. I needed to get out of life. I didn't know, I was 10, 11 years old. I didn't know any other way to I didn't know any other way to shut down. Luckily, I had really, really, really good treatment from the very beginning. The nurse was the main reason behind my recovery. I feel like nurses are the people there all the time. You talk to your psychologist once a week, but you don't know when you're going to have a breakdown. You could have an episode at 1 a.m. in the morning. The nurse is the one there to help you out. I feel like I've been through this because there's something that I need to do with it, and I've survived. Like I've had so many bad lows where I've tried to attempt suicide, and I've had so many times where my weight was quite low that they weren't sure I was going to make it through the night, but I survived, and I think it's because it's a sign that I need to carry on for others.